up, everybody? This is Chase, and welcome back to the Wellness Center podcast. It has been quite some time since I have done a peer-reviewed scientific study. There's some new ones that I found, and I wanted to go over them with you really quick. So, I found one today about cancer. So I just want to dive right in and talk about the cancer, the side effects of cancer, and what red light therapy can do to help you out. All right, I'm going to go ahead and share my screen here. Now, again, my camera's right here, my screen's right here. So if it looks like I'm looking down, it's because I am. All right, so we are looking here at the National Cancer Institute and then with the National Institute of Health, and we are looking at the side effects of cancer treatment. So cancer treatment in cancer can cause side effects. Side effects are problems that occur when treatments affect healthy tissues or organs. Of course, speak up about any problems you have. If you are currently undergoing cancer and you're experiencing any of these things, it's great to talk to a medical health care provider about some of the issues, and they can help you with that. So here are some of the things that you can notice when you're with some side effects of cancer: anemia, appetite loss, bleeding and bruising, constipation, delirium, diarrhea, edema, fatigue, fertility issues, fertility in boys and men, fertility issues in girls and women, flu-like symptoms, hair loss, infection, and lymphedema, memory and concentration problems, mouth and throat problems, nausea and vomiting, nerve problems, organ-related inflammation, pain, sexual health issues in men and in women, skin and nail changes, sleep problems, and urinary and bladder problems. Side effects can vary from person to person, even among people receiving the same type of cancer treatment. So just something to be aware of. All right, let's go into the juice, the good stuff. So I am here on europepmc.org, and the title of the article is Photobiomodulation, which is the fancy term for red light therapy, in the prevention and the management of side effects of cancer treatment, bases, results, and perspectives. This was published the 17th of October, 2023. And let's look at some of the stuff here. So the background states that to assess the current and potential indications of photobiomodulation therapy and their levels of evidence in the prevention or treatment of the side effects related to oncology treatments, radiation therapy, and report on the recommended modalities of photobiomodulation therapy. So what they did is they went through Embase, Medline, PubMed, Cochrane, EBSCO, Scopus, and Lilacs databases were systematically reviewed. So these people looked at a bunch of different studies and looked at all of the different results. So this is a multifaceted, multi-location, multi-research collection, aggregation of data to really see how efficient red light therapy is in the treatment of the side effects related to cancer. So the results, and this is the big stuff. Photobiomodulation in the red or infrared spectrum, which we use both, has been shown to be effective in randomized controlled trials in the prevention and management of certain complications related to radiotherapy. In particular, acute mucositis, epitheliitis, and upper limb lymphedema. Cool. The levels of evidence associated with photobiomodulation therapy was heterogeneous, but overall remained moderate. So good results. The main limitations were the diversity and the lack of precision of the treatment protocols, which could compromise the efficiency and the reproducibility of the results of photobiomodulation. That's a great note there, just to talk about how wide and different and broad and vast red light therapy actually is, and how many different devices there are, the power outputs, the wavelengths of the lights. There is really a lot of science that needs to be done. There's a lot of research that needs to happen in order to find what's most efficient. For other effects related to the chemotherapy, which include things like peripheral neuropathy, alopecia, hair loss, and a lot of things, the photobiomodulation suffers from a lack of studies or limited studies at the origin of a weakened level of proof. So again, like I was just saying, more research needs to happen. The conclusion is it states that photobiomodulation could therefore be considered as supportive care in its own right for patients treated with radiation, chemotherapy, immunotherapy, hormone therapy, or targeted therapies, whether in a clinical practice or in clinical trials. So guys, yeah, it can help. Now, I also want to look at some natural at-home treatments for the side effects of chemotherapy, because I think having an adjunctive treatment plan, whether that's working with a healthcare provider, doing red light and doing things at home, is what's going to provide the most effective results for you. So some at-home remedies, and this is from WebMD, so pretty prestigious website. So herbs and other supplements can also help with the side effects of radiation therapy, chemotherapy, acupuncture. You can also look into doing massage, hypnosis, guided imagery, aromatherapy, and it's really up to you on what you find works best for you and your system. So guys, that's everything I have for you. Thank you so much for tuning in today. I really appreciate it. In conclusion, my personal conclusion, red light therapy is an effective modality of relief for the negative side effects that come from radiation and chemotherapy. So if you know someone who's currently suffering with chemo or radiation therapy, please send them our way. Their first session is free. Sessions can get as cheap as $8 per session. Would love to help them out. Would love to help you guys out. I hope you have a great rest of your day, and I'll catch you on the flip side. Peace out.